Once a patient is logged in, the spasticity reduction program is typically the first program for most patients. This program can be used on the hand mentor or foot mentor. In this example, we will show the hand mentor. The default settings for this program are 10 stretch cycles at 30 seconds per stretch. The therapist can override these settings based on the needs of the patient. The number of cycles can be changed from 1 cycle up to 60 cycles, and the stretch time can be adjusted from 10 seconds up to 2 minutes. Every time the patient's hand is raised, the scale of the visual feedback is adjusted based on the patient's performance on the previous cycle. If the visual feedback disappears too quickly or stays in the middle the entire time, this is not clinically relevant feedback. The visual display is constantly being readjusted so the patient sees the feedback for as long as possible during a stretch cycle. You can turn on or off the wrist angle display. This shows the patient and the therapist the current position of the wrist, but may distract the patient from the goals of the therapy program. The purpose of this program is to stretch the wrist and fingers into extension and show the patient how much force is being exerted on the hand mentor. If the patient can actively reduce their flexor tone, the amount of force being exerted on the handpiece will decrease. The thermometer gauge will move from the yellow to the green and eventually disappear. If, for some reason, the patient's tone increases, the gauge will move from yellow up to red. Sometimes this is seen if the patient has a spastic reflex from a yawn or a sneeze. Initially, the patient's hand is raised to a wrist angle of 35 degrees. This may be less if the patient exhibits high tone. The air muscle will stop inflating if it senses high tone in the patient's flexors. Teach the patient breathing or relaxation techniques and encourage them to watch the thermometer and realize that they have control over the amount of tone in their wrist and finger flexors. This program is a good warm-up before attempting any motor control exercises and is also a good cool-down after a session of motor control exercises. See the other videos in this series to learn about the other types of programs for the hand mentor and foot mentor.